Hello to our valuable viewers and followers in Liberia, Africa, and rest of the world. This is WAP TV Liberia, publisher of Dahomey Communication Cooperation Incorporated. I am Thomas Krepler. Is designated by the United Nations as Universal Health Coverage Day. Countries across the world are encouraged to plan appropriate activities to provide universal health access to their people. WAP TV Liberia witnessed a civil society public forum under the auspices of a local group, the Partnership for Sustainable Development PASS. The group said the forum is civil society commemoration of UHC Day in Liberia. Of the government of Liberia, Ambassador Bobby Whitfield sounded the important role access to water, sanitation, and hygiene have to play in national effort to provide Liberia's population access to basic health care. Here is Ambassador Whitfield.
And we always say health is wealth. But to get to that wealth, we must, as government, make sure that you are empowered. Your well-being, your welfare, your capacity is developed to the extent that you are able to operate your facilities. So, because everything you are doing here is about universal health coverage. How do we access universal health coverage? It's through gathering like this, discussing this issue, bringing it to light, and taking concrete action. So I want to really congratulate you for observing this day and making it happen in Liberia. The effort will not go in vain. Some of us, we have seen the effort. We will elevate it at the level of the presidential appointees discussion. We will talk about it. We interact with our colleague at the Ministry of Health, the Minister of Health herself. We won't mention this meeting. Our part we're going to play in the whole healthcare system at the WASH Commission. It is the best fundamental. WASH, water, sanitation, hygiene. In fact, in the Latin world or the French world, the santé, that is, we're talking about the health. This is where the word sanitation comes from. And it's our first line of action. It's purely prevention.
An advocacy manager of the civil society organization, Ambassador Thomas Sellie, in a presentation of a report on a research study, learned that the public and private health care providers do not have written policy measures, standards, and systems to reduce risks of people with special social and medical conditions contracting COVID-19 and other diseases while they are seeking medical attention at various facilities. Listen to Ambassador Thomas Sellie.
So past study of the internal policy environment, 10 major facilities in health facilities in Mosurado and Magimi counties established that health facilities do not have a clearly written policy, standard, and systems that outline the do's and the don'ts in the provision of services for persons living with special medical conditions. That is the number one thing we have been able to establish. The next thing is the code of conduct for health professionals in Liberia under the auspices of the Liberia Medical and Dental Council and the NHSWP, that is the National Health Services or policy. The medical ethics are the only policies reliance of how the administrator, how the health workers and administrators are to comport themselves. That is
Civil Society Organization Research Report, Mr. N.S. Goyon, who is the acting director for Health Financing Unit of the Department of Policy, Planning, Research and M&E of Liberia's Ministry of Health disagrees. Listen to Mr. Ernest Goin.
When you're presenting your research, you spoke about the BPHS. The BPHS is one of the first generation of policy that the ministry had in 2005 to 2011. So between 2011 to 2021, we had an essential package of health services, so which is the EPHS1. So currently, that document has evolved to the EPHS2. So I will expect that you will go back and check the EPHS. You should go to the EPHS1 and not the BPHS because that document was developed in 2005. Okay? And the other clarity is the NHS-MPP, it should be NHS-MPP, is the National Health and Social Welfare Policy and Plan. That document was developed in 2011 and it expired last year from 2011 to 2021. Policies are normally developed for a period of 10 years. So the NHS-MPP has expired. We will develop another new document, which I'll also be telling you about. Just launched them today. That's why I'm saying smiling. Another information here is in the Ministry of Health, health facilities do not develop policies and standards. It's the Ministry of Health. Central Ministry of Health develop policies and standards and send them down to the health